Charlotte Works is the workforce development board serving Mecklenburg County and your source for the latest labor market news. Here's the quick story of our local healthcare industry. We're hiring a lot, but from a thinner than average talent base, which is what can create talent shortages. So if we look at the scale here, we've got 60,000 jobs here, while that national benchmark is almost double that. So again, we're below average supply for this kind of talent. Second, looking at the value, people are earning an average of just over $80,000 a year. That's on par with the national average. And then third, looking at that competition, the demand average is just over 2,000 postings a month, slightly below that national benchmark. So again, that competition slightly below average. If we look at the growth over time here, we've seen 14% growth over the past 5 years and another 10% projected over the next 5 years. But the keynote here is that gap is expected to widen between the actual and expected employment, again, highlighting some of those supply challenges may get harder, not easier. If we look at the demographics here, we see the retirement risk is about average with 15,000 workers age 55 and up versus a 16,000 benchmark. The racial diversity is about average with just over 30,000 racially diverse employees versus that benchmark around the same. And then the gender diversity around average, again, 54,000 versus 51,000 benchmark. And if we look at what are they actually hiring for, that occupation mix here, it shows what skills they really need. You see healthcare practitioners and technical support, healthcare support, office and administrative assistants, and then community and social services. And if we look at who's hiring for that, the demand is broad. We're seeing over 1,300 employers posting over 25,000 postings in the last 12 months. And that meeting posting stays open about 24 days, so just slightly longer than what's typical. The top posting volume, we're seeing companies like Atrium, Novant, and they're hiring for registered nurses, behavioral analysts, medical assistants, and surgical techs. So when we look at skills, the skill signal is pretty clear here. We're looking at a lot of clinical and operational skills, nursing, medical records, electronic and medical record, medication administration, data collection, and vital signs, plus workflow skills like billing, radiology, and care coordination. And so the bottom line is this is a large growing sector with massive hiring volume, but our local supply is thin. So solving workforce gaps here is about building and retaining talent, not just posting more jobs. For more information or for assistance as a business or a job seeker, visit charlotteworks.com.